Hello, everybody. This is Dr. Carl Hansen. Today's theme is if you are a Medicare eligible patient uh, and you live in Louisiana, I would strongly encourage you not to consider joining a Medicare Advantage plan, and specifically the UnitedHealth slash People's Health Medicare Advantage plan. The reason is fairly simple. If you are a patient who is a member of the United People's Plan in 2026, and you're seeing a primary care physician who is not in network, in other words, you have chosen to maybe sign up with a direct primary care doctor or something as your primary care physician, that if that primary care doctor sends you to a specialist, let's say a cardiologist, then United will make you pay cash for that cardiology visit. United will deny paying the cardiologist for that visit. And in order for you to accomplish visit, you would have to pay cash out of pocket for that visit. So what they are doing, United slash Peoples, is obstructing the practice of medicine. So if you're a primary care physician who may not be in network, maybe in practice for 39 years, clinically feels that you need to see a subspecialist, United Health does not consider that a valid referral just because a board approved veteran physician feels that clinically the patient that you need to go see somebody. United disagrees and feels that they will not cover the cost of that. But instead, United states that your in-network primary care physician has to generate a portal referral, go online and generate a referral. Now, to call these referrals is silly because a referral is one doctor communicating with another doctor and say, hey, could you see Miss Jones, etc. All this referral is the primary care physician having to do a more administrative burden, log on to a portal, have to justify for the insurance administrator eggheads that the referral is going to happen and is necessary. That to them is more important. The data entry part of a referral as opposed to the clinical need for a referral. And I really stand by that's obstructing the practice of medicine. And United slash Peoples does not have a license to practice medicine in Louisiana. Furthermore, United slash Peoples in Louisiana is saying, so what, patient? So what, you've been seeing Dr. So-and-so for 30 years as your primary care physician, and you've built up a trusting relationship. Y'all understand each other. That is the most important part of practicing medicine, is the physician-patient relationship. United doesn't care. They don't think that it's a thing. And they're willing to, matter of fact, they're encouraging people to sever that physician-patient relationship. That is completely antithetical to good health care. And I'm saying now, United slash People is antithetical to good health care and what's in the patient's best interest. These Medicare Advantage plans, such as United slash People's Health, continue to get increases in funding from the federal government. They're projected in 2026 to get at least a 5% increase in the amount of funds that the federal government, that Medicare, pays these Medicare Advantage plans. Meanwhile, the real doctors on the street who are taking care of people and billing Medicare, that accept Medicare, they're seeing declines in reimbursement in many things. So the private physician is seeing degradation of how much income Medicare gives. The Medicare Advantage group is seeing increasing amounts of monies coming in from the government. So these Medicare Advantage plans, United slash, continues to get more money from Medicare. But on the other side, they like to deny, through obstruction, prior authorizations, etc., they like to deny and delay health care that is delivered to patients in many instances. So they're making it on both ends. And let me say that I'm not a licensed benefit advisor. However, I didn't fall off the avocado truck yesterday. I know how the sausage is made. I know what matters to United/Peoples. The stockholders matters. The stock prices. They had some stock price decline, so probably they put the clamps down even tighter. That's their solution, is to cause more grief and burden for the patient. Just notice that when you sign up with these plans, your network becomes very constricted. Your access becomes very constricted. Also, let me say, I know some people are in certain financial situations that there is a financial advantage to joining a Medicare Advantage plan. And so each person needs to make that decision for themselves. And I do talk to my patients individually about this. So I realize that some people are in a bind, that MA plan is probably the best option for them. But in the big picture, my advice at least is to seriously consider, if you're on an MA plan, especially the United/Peoples, to terminate that relationship. If you are aging into Medicare or becoming Medicare eligible, that you seriously consider not joining United/Peoples. Thank you.